Hello, and thank you for joining us for today's webinar, HIPAA IT Pitfalls to Avoid in 2015, brought to you by eFax Corporate. Today we will be discussing HIPAA compliance and exceptions, as well as common misconceptions to avoid in 2015. I'm Brad Spanbauer. Before we begin, let's cover a few housekeeping items. First, you should see a Q&A box in the top right area of your screen. At any point during our session today, feel free to submit a question to us in this Q&A area. We will try to answer your questions during the webcast, but if a more complete answer is needed or if we run out of time, we will reach out to you after the webinar and answer your questions then. Also, at the bottom of your screen, you will notice a green icon file folder. This is our resource list, and in it we have enclosed some relevant white papers and documents pertaining to today's event. We will also send you an email with these same white papers along with a recording of the event. And with that, we hope you enjoyed today's webinar. So one more small piece of housekeeping. I am not a lawyer, and the information we provide in the presentation today does not constitute and is no substitute for legal or other professional advice. We strongly encourage you to consult with your own legal or professional advisors for individualized guidance regarding the application of the law to your particular situations and in connection with any other compliance-related concerns. So on with the show. So are you HIPAA compliant or not? With the adoption of the Omnibus final ruling in September of 2013, many healthcare IT directors were faced with this seemingly simple question by their organization's senior management. Are we or aren't we HIPAA compliant? Well, this seems like a simple question, but ever since HIPAA was enacted in 1996, hospitals, group practices, and other covered entities have struggled with their response. Even with 17 years to prepare, many providers were still scrambling to meet all the requirements defined in the Omnibus rule. So for today's agenda, we're going to cover the most common incorrect HIPAA assumptions and provide a detailed examination of the Conduit exception, one of the most misunderstood provisions of HIPAA and the final rule. We will also discuss the BAA as well as data encryption. So earlier this year, we conducted a survey of our customers in the healthcare industry, and the results, while not exactly surprising, were enlightening. Our Healthcare IT Pulse survey revealed top concerns related to transferring sensitive healthcare information, technology usage patterns, and top security and compliance issues. As it relates to documents, change brought on by legislation such as the Affordable Care Act, including the new healthcare exchanges, often means a sudden influx of added paperwork for healthcare organizations. We found that 54% of organizations surveyed cited HIPAA compliance as their top concern, even more important than document management, organization, and record keeping. Even after the publication of the Omnibus rule, HIPAA contains few absolute measures that must be implemented to achieve compliance. And once you've deployed the technology solutions, implemented the policies, and trained your personnel, there's still no federal certification or stamp of approval to reassure you. IT departments' efforts are often undertaken with little understanding of what's actually required in order to achieve HIPAA compliance, and frequently result in processes that are lacking in small but important ways. From our conversations with customers regarding their compliance needs and solutions, we hear several reoccurring incorrect assumptions that can spell trouble. Here are 7 of the most common incorrect HIPAA assumptions we've encountered. Misconception number 1. Our vendors' services are HIPAA compliant, so we're HIPAA compliant, right? Well, we frequently encounter IT managers who firmly believe that deploying a software package touted as HIPAA compliant is all that's required to achieve compliance, and they are wrong. Compliance with HIPAA requirements is not transferable. While your vendor's status is important, your organization should implement its own comprehensive HIPAA compliance program. You'll want to make sure that your processes are HIPAA compliant, and then select vendors that fit your organization's security framework. Misconception number 2. Our vendor signed a BAA, so we're covered, right? Well, vendor selection should be guided by established protocols in your overall HIPAA compliance program. When entering into a relationship with a vendor, it's like that old adage says, trust but verify. Even if a vendor willingly offers to sign a BAA or a business associate agreement, you should always perform due diligence to ensure their product or service is a match for your organization. Consider the BAA to be a starting point of your discussion, not the end point. Misconception number 3. We don't use cloud services because they're not secure, right? Well, this assumption is no more true than concluding that on-site solutions are always secure. Cloud services offer a number of advantages: cost savings, increased efficiency, lower infrastructure overhead over their traditional counterparts, and many offer HIPAA-compliant services tailored to the needs of healthcare customers. Misconception number 4. Our corporate policies restrict access to PHI, so we're in compliance, right? Well, while policies and procedures are key to any HIPAA compliance program, these elements are nothing without rigorous, ongoing monitoring, enforcement, and adjustment. Your organization should always be on the lookout for security breaches, both technological and procedural, to ensure PHI, or protected health information. You want to make sure it's secure. HIPAA requires that your compliance policies and procedures be living documents. Your organization should be regularly reevaluating and updating your compliance program and conducting training sessions with employees to reinforce policies and procedures. Misconception number 5. We use an in-house fax server, so our transmissions are secured behind our firewall. Well, fax servers can help ensure security of protected health information during transmission, but often fall short in protecting the same data while stored on your network. Fax servers often hand off PHI data to email or file servers that may be vulnerable to unauthorized access from within your network. Encryption of stored PHI is an addressable implementation specification, so you'll want to seek solutions that offer at-rest encryption of PHI stored within your system. Misconception number 6. Our EHR system has a well-documented audit trail, so a document sharing policy would be redundant. Well, an audit trail is great, but it only covers data while it lives within your electronic health record system. What happens once a record is printed? Consider implementing a clear, comprehensive document sharing policy that addresses handling of PHI both within and outside of your EHR system. Think of the document sharing policy as a complement to your EHR audit trail. It's not a redundancy. And misconception number 7. Our email provider offers TLS encryption, so we're secure sending email attachments, right? Well, TLS encryption is a great tool to help secure emails in transit, but it only works if both sides of the email transaction are configured properly. Many consumer email providers aren't equipped to support TLS encryption for their subscribers, and if your email provider is only using opportunistic TLS and the recipient doesn't support TLS, emails with PHI could be transmitted with no encryption at all. You may want to think twice about sending PHI over email, particularly when other more secure methods are available. So now that we've discussed some of the more common misconceptions, let's put this information into practice. So one of the key findings from our survey that we cited earlier is that fax continues to be a favorite approach for communication. As 61% of healthcare organizations surveyed cited fax as one of the top approaches to exchange critical information with non-employees, with 26% citing fax as the #1 approach to exchanging critical information. Meanwhile, other methods, for example, digital file transfer, was ranked #1 by only 6% of respondents, and email was cited by 12% of healthcare organizations as one of their 2 least used methods of communicating and exchanging critical information with non-employees. Yet there are still some misunderstandings about how faxing is treated for HIPAA compliance. So let's talk about the conduit exception. Consider the often misunderstood HIPAA conduit exception and related comments in the Omnibus final ruling. The conduit exception applies to vendors, either offline or online, that provide a service that acts as a transport for PHI, but does not necessarily access or store the information. So to illustrate this, let's consider 2 usages of the same basic hosted fax service with one key difference: document archival. Scenario number 1, hosted fax without archiving. This version of the hosted fax service does not store send or receive faxes. It simply transports them from sender to receiver. And remember, this should be done with transport layer security encryption while in transit. There is no electronic archival or storage involved with this service. Users can't go back a day, a week, or a month later and retrieve or search by keyword for faxes they sent and received. This service would fall under the Conduit exception. Conduit exception scenario number 2, hosted fax with archiving. Now, if the same service offers an online storage function for the faxes your users send or receive, it would most likely not be subject to the Conduit exception. And as a covered entity, you would need assurances from the vendor or the business associate that those documents are secure. This assurance most likely would come in the form of a business associate agreement, or a BAA. Looking at these two examples, where problems can occur is if the vendor doesn't understand these differences. As a covered entity, you may rely on the vendor to know the differences. But if a vendor simply says, "We always sign BAAs," for example, you might enable or disable a security feature, not realizing that it changes the nature of the HIPAA compliance requirements for that service. It's important for covered entities to remember a BAA does not transfer all responsibility from you to the vendor. It establishes a shared responsibility. So if you rely on a BAA from a vendor, you still have responsibility for the privacy and security of your PHI. Let's go back to the second scenario where you use an electronic faxing service and you want online archival access. You may have a BAA with a vendor, but we also recommend that instead of sending or receiving documents containing PHI to and from a personal productivity application such as MS Outlook, that the service instead send encrypted notifications to an email address. The user would then use a password to log into the online service and access their electronic faxes. This could certainly be a HIPAA-compliant solution. It's not subject to the Conduit exception, but one where, since the vendor is storing PHI as part of their overall service, may offer both encrypted in transit and encrypted at rest security. While encryption is not mandated under HIPAA, it is considered addressable, and we encourage providers to consider it a requirement and adopt it as a best practice. And remember, the security rule states that addressable specifications are required in any situation where the implementation would be reasonable and appropriate. If the situation is not reasonable, then the reason must be documented and an equivalent security measure must be implemented. For document and data transmission and storage, encryption in transit and at rest should always be considered best practice. This is in addition to the physical security measures that the vendor employs at locations for access to servers, data centers, and the like. We believe it is best to combine services that either meet the Conduit exception or have the right level of security, encryption, and protection with a well-documented procedural audit of how your organization manages and interacts with data and documents. With the omnibus rule being adopted at the end of last year, a lot of covered entities have focused on the first A in HIPAA, accountability. As well they should. The emphasis has been put on the responsibility of all parties involved, covered entities, healthcare providers, business associates, to ensure patient data is not compromised. But it is important to remember that the P, portability, was a driving force behind the passage of the original HIPAA Act in 1996, reaffirmed by language in HITECH in the Affordable Care Act. Not that long ago, patient records were stagnant, usually kept in manila folders in the doctor's office. The ability of physicians and providers to share this information with specialists and other caregivers was an onerous task. Balancing the portability and accountability has always been a challenge, even with EMRs. This is where the idea of secure, at rest, and secure in transit PHI comes into view. So what have we learned? There are no absolute assurances when it comes to HIPAA compliance, but by making yourself aware of the common assumptions, you will be more prepared to provide greater consideration to the compliance of your data and document management processes. So next steps. As a follow-up to this webinar, I encourage you to read an article recently published on HITECH Answers about the 7 HIPAA assumptions. We will also send you a white paper And in a follow-up email, you get a link to this recording that you can share with your colleagues, as well as a PDF of Is Cloud-Based Faxing Right for You? Finally, you have the opportunity to try cloud faxing for yourself with a free 30-day trial. And with that, we can open up the call to questions. So let's answer a few of your questions now. So let's see. Okay, of the available do-it-yourself SRA guides, which one do you recommend? Is there a fail-safe method that you are aware of? Well, there are a number of different SRA guides and tools and checklists that you can either pay for or get for free. I'm partial to the free one from the healthit.gov site. It's really comprehensive. They have online tutorials and training videos and checklists, and it's coming right from the source. So it's my preferred guide, and it doesn't cost anything. So if you're going to do a security risk assessment, especially your first one, I would start there. If you find it doesn't meet your needs, then you can go on and look at some of the paid services, but it's not always necessary. So next question, what are some of the most glaring issues you see with practices trying to be HIPAA compliant? So by practice, I assume you mean healthcare practice. So the biggest issue is people have a tendency to focus on keeping their systems compliant, but ignore training for staff and the regular updates that need to happen as part of compliance. So just making sure that your systems are up to snuff is only half of it. You need to make sure that your staff know and are following the guidelines that you put in place. Next question. I know there are many risk analyses that are failing. Can you review how many are passing and who they are? Short answer, no. I don't know of any public records that track that information, but I will look into it. Perhaps there is something out there that where they compile that data, and I'll take a look and see if I can find it. If I can, I will send you an email directly. Last question. I use the SRA from healthit.gov, and it has been finished. My question is, would this suffice for a possible MU audit? So look at that, somebody else who likes healthit.gov. So would it suffice for an audit? No. It's a great starting place, and I recommend it, but remember that these are generic guidelines that cover all sorts of entities. So you need to make sure that, aside from doing that audit, that you make sure that if there are specific items that relate to your practice or business, that you're making sure that they're compliant as well. So it's a great starting point, but it's not the end point. So that's all we have time for today. With that, I thank you for your attendance, and I hope to engage with you soon. Have a great day.